It's the end of September, and we're now in the fourth wave of the COVID-19 pandemic. And yet Ontario's daily COVID case counts are lower than what many experts had predicted. In the summer, the province's top doctor warned of a September surge in cases, but so far, it hasn't happened. The daily case count remains under 1,000, and the graph of Ontario's 7-day average roughly shows a plateau since the beginning of September. Joining me now to discuss this is Dr. Raywat Deonandan, an epidemiologist and science communicator specializing in global health at the University of Ottawa. Raywat Deonandan, thanks so much for joining us.
Thanks for having me back.
Dr. Deonandan, the worst case scenario in Ontario's most recent modeling showed about 4,000 daily cases by now. We're well below that. Would you agree that things are going pretty well in the province right now?
Things are going extraordinarily well with a little bit of uncertainty. It could go south anytime soon now, but let's celebrate the good news. Things are much better now than we thought we would be. So that's good.
Why is this happening? To what would you attribute the province's relative success?
Yeah, it's a good question. A number of factors. First, the vaccine uptake has been really good. Since the announcement of the vaccine passports, the vaccine uptake has been even better. Then we have the universal mask mandates that have been quite well adhered to, and the slow but important realization of airborne transmission of this disease, meaning that many people are taking ventilation seriously as a mitigation tool. So the introduction of HEPA filters in some schools and workplaces, I think, has really reduced the probability of transmission. All those things combined, probably keeping the rates low. But I think the most important thing is the power of vaccination is preventing penetration of infection too deeply into the community.
Are you surprised then at how well things are going?
I am surprised, but I'm cautious because there is a lot of fragility and instability in the numbers. The cold weather is just starting. It's well too early to know the impact of school openings or even the back to work for many businesses the last couple of weeks. Those numbers will start to come in very, very soon. And as the weather gets worse and people spend more time indoors, we could see more transmission. However, the introduction of the so-called vaccine passports might even mitigate that risk. So there is reason to be optimistic, but also reason to be cautious and not to take our foot off the pedal.
You alluded to schools there. I know at the beginning of September, many people were worried that by Thanksgiving, many of our schools would be closed. That too probably won't happen. Should that not count as a success as well?
It should count as a success, but again, we got to be careful here. The prevalence in the incidence rate in schools is still higher than I'd like, 7% in some cases. The number of active cases in the Ottawa area in schools is over 120. It's too much. So we need to use new tools, things like rapid tests, would be very useful right now, until we can start vaccinating kids under 12, and that's coming soon.
What are the biggest concerns that you have about school-age children right now?
The biggest concern for school-age children is that the hospitalization rate that we're seeing in the USA is as high as 2%. And that wasn't that much of a concern in previous waves, even though it was a concern, because the kids weren't being as infected at the same rate. But with Delta, the kids can get infected quickly. And so with a large number of kids being infected and this fairly robust hospitalization rate, we might be seeing a stressed pediatric healthcare system. And nobody wants kids in hospitals. That is always my biggest concern. Previously, my concern was transmission in schools would lead to acceleration of the pandemic outside of schools. That's less of a concern now that we have more immunity built into the community via vaccination.
The province's chief medical officer had this to say. He said, right now, the outbreaks have been limited. They've been spreading from 1 child to 2 to 4 children. With Delta, I think that's a win. We've been able to limit the spread to that few, and that was Dr. Kieran Moore, Ontario's chief medical officer of health. Your response to that?
It's a curious thing to say. It's never a win when you have one person spreading it to more than one other person. That is literally the definition of exponential growth. It's not something to celebrate if you're seeing exponential growth in schools. His perspective, I suppose, it's not as bad as exponential growth as we would see if there are no mitigation tools in place, hence seeing the full power of Delta. That's an odd definition for a win for me. A true win would be zero transmission or controlled transmission leading to extinguishing of the outbreaks. That's not what we're seeing yet.
What is your modeling telling you about what we can expect in the coming months in this province?
Well, it's not my modeling, but looking at what the Ontario Science Science Table is saying is this wave is scheduled to diminish by sometime in early November, assuming everything continues to go well. And again, things might go poorly at any moment if we do something bad or make some poor choices. And again, I want to stress the fragility and the instability of the data is based upon things like uncertainty in the power of vaccination. Vaccination is extraordinary, but its ability to prevent actual infection is debatable, to say the least. Then we don't know yet what the impact of the school openings will be, and we don't know what's going to happen when the weather gets cold. Having said all that, I'm an optimist by nature, and I think we're going to be out of this before the end of this semester.
A lot of people are looking west right now. They're looking at Alberta in horror at the situation there. I think some 5,000 cases of COVID-19. What can we learn from that province's experience and the way they have handled, or some might say mishandled, COVID-19?
There's so much to learn here. First of all, they open things up way too early before there is sufficient vaccination. Their vaccination rates are atrocious, frankly. It's about 60% of the total population is vaccinated in Alberta. In some parts of the province, it's less than 50%, and that is unacceptable for a point at which to open things up. Second of all, now that they're in crisis with triaging of care, I hear, there are still no restrictions in place to slow the flow of patients into the hospital. So they have failed to prevent the emergency, and they're failing to slow the emergency to give their healthcare system a chance to breathe. What we're doing in Ontario is so much better. We've been slow to open, and we have much better vaccine uptake. Here in Ottawa, 90% of our eligible population, I think 80% of the total population, has been vaccinated. That's extraordinary. It's not quite good enough yet, but it's close to being good enough. So we should take some solace that we have outperformed the West in these important metrics.
Dr. Raywat Deonandan, thanks so much for joining us. We appreciate it.
It's my pleasure.
Thank you.